So for this one, I probably wouldn't use this small kidney for things like pyramids and columns when we've got so many other big ones. But we could do things like, for example, what would you call this whole outer layer of dark brown here?
Fibrous capsule.
This is the capsule, exactly. And what you can also pretty easily see on this small one here is the major layers. Like all the outer layer here is
The cortex.
cortex, and the alternating pyramid column makes the inner layer called
The medulla.
medulla, or medullary layer, right.
Okay.
Now, we can see some calyxes and things like that, but we'll save those for the bigger model. What would you be saying if you were asked to name this structure?
Ureter.
Ureter, exactly. What about if a sticker in here asking you to name this whole structure?
The urinary bladder.
Urinary bladder, or just bladder is fine, yeah. The reason you usually do, or like my handout says urinary bladder, is to differentiate it from the gallbladder. But if you're going to drop a word from one of those, it's the urinary. You can usually drop urinary and just imply that it's the bladder. Okay, what region of the bladder are you seeing here? The trigon, because these two holes come from these two ureters, whereas this hole leads into what passageway right here? Urethra, yes. Be very, very careful with spelling, because urethra can easily become ureter with a couple of letters moved around. Or I've even had people write uterus as their term, because urethra, ureter, uterus are also similar. It's very easy to write the wrong thing, so make sure you're careful. What would you say if you were asked, name the muscle here?
The detrusor.
Good, detrusor, in all of the wall of the bladder, except there's a piece of muscle here and here that would surround this urethra.
That's the external.
Internal urethral sphincter. The external would be down here, but that muscle is not shown, so we know the only one that can be asked is internal urethral sphincter, there and there. That's this whole model.
How are you going to frame that question?
If the sticker, there's a big difference between say name the muscle here versus name the muscle here. When you're here, just generally in the wall of the bladder, it's detrusor. When you're right at the entrance into the urethra, it's got to be the internal urethral sphincter.
And is this the one that you used with like the inferior vena cava?
Sure, right? So in addition to the smaller vessels in the kidney, what's also on the list again is abdominal aorta, inferior vena cava, and renal artery and renal vein. Even though you can see the renal artery and renal vein as these two major ones here, it's especially nice to see them actually off of the major trunk vessels, right? The abdominal aorta, the inferior vena cava. So just those here. All these little vessels in this little kidney, way too small when I've got nice big ones to use, right? But yeah, that's this whole model.
Perfect.